It is well known that nutrition is an important component of a healthy pregnancy. A healthy lifestyle positively impacts fertility, the course of the pregnancy, and can serve as a way to impact the increasing widespread presence of obesity and associated chronic health disorders. New research is showing that nutrition and lifestyle factors not only maximize health in the pregnancy, but may lower future risk of disease for both the baby and the mother. Pregnancy is a time where it is common for women to have more awareness of healthier lifestyle behaviors and an interest in implementing them. In this video, we will discuss what to be aware of in pregnancy and some healthy lifestyle changes that are recommended for pregnant women and new mothers. We will begin by going over a brief history of dietary recommendations in the U.S. In 1990, the weight gain recommendations for pregnancy from the Institute of Medicine were meant to decrease instances of premature births and small for gestational age babies. Since these recommendations were made, the guidelines have been revised based on the widespread increase in obesity and long-term health issues that correlate with high gestational weight. When it comes to exercising during pregnancy, women were historically instructed to rest as much as possible and were taught that a sedentary lifestyle while pregnant would protect the baby and the mother. It is now well recognized that physical activity during pregnancy is generally considered to have minimal risks and significant benefits. Recommendations for a healthy pregnancy are ever changing and evolving. Let's cover some of the more current recommendations now. Weight gain during pregnancy is a tricky balancing act because the nutritional needs of the fetus must be met, but excessive weight gain can lead to overweight or obesity for the mother. The current recommendations for optimal nutrition during a non-diabetic pregnancy, according to the Institute of Medicine, are individualized based on BMI. Energy needs during pregnancy can vary from person to person based on physical activity levels and age, but the recommended calories range from 2,500 to 2,700 calories per day. Because we are talking about nutrition in pregnancy, we need to take some time to address obesity. 1/3 of women of reproductive age are obese. Being obese while pregnant leads to a higher risk pregnancy, with increased chances of spontaneous abortion, gestational hypertension, preeclampsia, gestational diabetes, complications during delivery, and higher chance of a cesarean birth. Obesity during pregnancy can also make it more challenging to do ultrasounds, monitor the baby's heart rate, and keep track of contractions. Losing weight postpartum is something that many women struggle with, and despite the common belief that breastfeeding helps women to lose weight post-pregnancy, the data imply that the benefit is not significant. Safe exercise during pregnancy is encouraged for healthy pregnant women with no medical or obstetric conditions. Physical activity during pregnancy has shown to decrease excess weight gain and decrease weight retention postpartum. The recommendation is at least 30 minutes of moderate exercise on most days of the week. Some things to be aware of while exercising during pregnancy are to avoid anything that risks abdominal impact, especially in the second and third trimesters. Positions like lying supine during the second and third trimesters should also be avoided. It is important to be aware of the heart rate, especially for women who do intense workouts while pregnant. There are women who should not exercise while pregnant. This includes women with heart or lung disease, incompetent cervix, and persistent second or third trimester bleeding. There is a growing body of scientific evidence looking at adult diseases that stem from fetal origins, with the data indicating that there is a link between the intrauterine environment of the mother affecting the future health of the fetus. Epidemiological studies have shown that limited intrauterine nutrition could lead to an increased risk for type 2 diabetes, coronary artery disease, and hyperlipidemia. Small for gestational age babies have been shown to have an increased risk for heart disease. This area of study is relatively new, but it is growing, and it appears that intrauterine nutrition plays a bigger part in long-term health than was originally thought. When considering nutrition in pregnancy, there are some cases that require extra attention and care to ensure a healthy pregnancy. One example of this is women who are pregnant with multiples. The caloric and supplemental vitamin needs increase with these cases, and healthcare providers often recommend that women pregnant with multiples seek out additional guidance from a nutritionist to ensure that she is meeting the nutritional needs for healthy fetal growth. While a vegetarian diet is considered safe during pregnancy and lactation, there should be attention paid to the increased demand for macro and micronutrients during these times of increased nutritional needs. This includes making sure the mother is getting enough protein, omega-3 fatty acids, iron, zinc, iodine, calcium, and vitamins D and B12. Again, seeking advice from a nutritionist can be a good source of guidance. Another case for extra attention to be cognizant of is the cultural trend of pregorexia. This term refers to the desire to gain minimal weight during pregnancy and lose it as fast as possible after the pregnancy. There is a cultural expectation to keep up a thin appearance during pregnancy, more so now than ever before. Expecting mothers striving for this thin appearance may deprive themselves and their growing baby of essential nutritional needs. Healthcare practitioners should be aware of this trend, as they are in a position to counteract the potential harm with education on healthy nutrition and weight gain in pregnancy. Another group that needs special nutritional attention during pregnancy are adolescents. A study done in the UK showed that pregnant teens take less B12 and folate than necessary during pregnancy, and these deficiencies are associated with small for gestational age births. Factors that may be particularly present in teen populations, such as domestic violence, sexually transmitted infections, unplanned pregnancies, can lead to a higher chance of the mother not reaching an appropriate pregnancy weight gain. It is important to be aware of the implications of using tobacco and alcohol during pregnancy. Smoking increases many pregnancy complications, including miscarriage, premature delivery, low birth rate, ectopic pregnancy, placenta previa, intrauterine growth restriction, and sudden infant death syndrome. Tobacco use is one of the most impactful modifiable risk factors in pregnancy. Consuming large amounts of alcohol during pregnancy is associated with low birth rate, preterm babies, and small for gestational age babies. Some studies have shown that light to moderate drinking during pregnancy showed no effect, but pregnant women are advised to avoid alcohol altogether because the amount that is harmful is not known. Many expectant mothers are wary of the effects of caffeine during pregnancy. The American College of Obstetricians and Gynecologists stand by the view that moderate caffeine is safe during pregnancy, but does warn that the impact of large amounts of caffeine during pregnancy are not entirely clear. There is clearly a lot known today about healthy nutrition and lifestyle do's and don'ts during pregnancy, and what we have gone over in this video really only scrapes the surface of what there is to know. Pregnancy is a time when women are often wanting to take action and make healthier choices for themselves and for their babies, and it is clear that making some simple changes to diet and lifestyle can have a profound impact on the health of the mother and the baby, both during pregnancy and later in life.